Hey, do you suffer from an enlarged prostate that causes you trouble with urination, sexual function, and overall quality of life? If so, you are not alone. Millions of men around the world face the same problem as they age. But don't worry, there is a natural and simple solution that can help you shrink your prostate and improve your symptoms. And that solution is vitamin D. Yes, you heard me right. Vitamin D, the sunshine vitamin, can do wonders for your prostate health. In this video, I'm going to explain how vitamin D works, how much you need, and how to get it. I'm also going to share some other natural remedies and tips that can help you with your prostate problem. So stay tuned and watch this video till the end, because you don't want to miss this valuable information. Before we get into the details, let me quickly introduce myself. I'm Dr. William Henry, and I'm working from last 17 years. I make videos about various health-related topics. If you are new to this channel, please consider subscribing and hitting the bell icon, so you don't miss any of my future videos. And if you are already a subscriber, thank you for your support and welcome back. Now, let's talk about vitamin D and how it can help you with your prostate problem. Vitamin D is a fat-soluble vitamin that is essential for many functions in our body, such as bone health, immune system, and hormone regulation. Vitamin D is also involved in the growth and maintenance of the prostate gland, which is a small organ that produces the fluid that nourishes and transports sperm. As men age, their testosterone levels decline, and some of it gets converted into a more potent form called dihydrotestosterone, or DHT. DHT is responsible for many male characteristics, such as facial hair, muscle mass, and sex drive. However, too much DHT can also cause the prostate to grow bigger and squeeze the urethra, the tube that carries urine out of the body. This condition is called benign prostatic hyperplasia, or BPH, and it can cause symptoms such as frequent urination, especially at night, difficulty starting or stopping the urine flow, weak or interrupted urine stream, feeling of incomplete bladder emptying, urinary urgency or leakage, pain or burning during urination, erectile dysfunction or reduced sexual satisfaction. These symptoms can be very annoying and frustrating, and they can affect your daily life and your relationships. Fortunately, there is a way to prevent and reverse this condition, and that is by increasing your vitamin D levels. Vitamin D can help shrink your prostate by inhibiting the enzyme that converts testosterone into DHT. By doing this, vitamin D can reduce the amount of DHT that stimulates the prostate growth and inflammation. Vitamin D can also modulate the immune system and reduce the oxidative stress that can damage the prostate cells. Several studies have shown that vitamin D deficiency is associated with increased prostate size and urinary symptoms, and that supplementing with vitamin D can reduce these problems. For example, one study found that taking 6,000 U of vitamin D per day for 12 months decreased the prostate volume by 15% and improved the urinary symptoms by 20%. Another study found that vitamin D deficiency was a potential marker of BPH, and that correcting the deficiency could prevent or delay the progression of the disease. So, how much vitamin D do you need to shrink your prostate and improve your symptoms? Well, that depends on several factors, such as your age, skin color, sun exposure, diet, and current vitamin D status. The recommended daily intake of vitamin D for adults is 600 to 800 U, but this may not be enough for most people, especially those who live in areas with low sunlight, have dark skin, or have a poor diet. The best way to know how much vitamin D you need is to get your blood levels tested. The optimal range of vitamin D for prostate health is between 40 to 60 nanograms per milliliter, according to some experts. To achieve this level, you may need to take a higher dose of vitamin D than the recommended intake, such as 2,000 to 5,000 U per day. However, you should always consult your doctor before taking any supplements, as too much vitamin D can also have negative effects, such as causing high blood calcium levels, kidney stones, or nausea. You can also get vitamin D from natural sources, such as sunlight and food. Sunlight is the best source of vitamin D, as your skin can produce it when exposed to the UVB rays. However, you need to be careful not to get too much sun, as it can also cause skin damage and increase the risk of skin cancer. The amount of sun exposure you need depends on your skin type, the time of the day, the season, and the latitude. A general rule of thumb is to expose your arms and legs to the sun for about 15 to 30 minutes, 2 to 3 times per week, preferably around noon, when the UVB rays are strongest. You can also get vitamin D from food, but the options are limited. The best food sources of vitamin D are fatty fish, such as salmon, tuna, mackerel, and sardines, which can provide about 200 to 600 U per serving. Other food sources of vitamin D are egg yolks, cheese, beef liver, mushrooms, and fortified foods, such as milk, yogurt, cereal, and orange juice. However, these foods provide much less vitamin D than fish, and they may not be enough to meet your needs. So, to summarize, vitamin D is a powerful natural remedy that can help you shrink your prostate and improve your urinary symptoms. To get the benefits of vitamin D, you need to get your blood levels tested and aim for 40 to 60 nanograms per milliliter. Take a vitamin D supplement, preferably with a meal that contains fat, to enhance absorption. Get some sun exposure, but not too much, to avoid skin damage. Eat more fatty fish and other food sources of vitamin D. But wait, there's more. Vitamin D is not the only natural remedy that can help you with your prostate problem. There are also some other herbs, minerals, and lifestyle changes that can make a difference. Here are some of them. Beta-sitosterol. This is a plant compound that can reduce the inflammation and swelling of the prostate, and improve the urine flow and bladder function. You can find it in supplements that contain saw palmetto, pygeum, ryegrass, or stinging nettle, which are all herbs that have been used for centuries to treat prostate problems. Zinc. This is a mineral that is essential for prostate health, as it is highly concentrated in the prostate tissue and fluid. Zinc can help regulate the hormones, reduce the inflammation, and prevent the infection of the prostate. You can get zinc from food, such as oysters, pumpkin seeds, beef, chicken, beans, and nuts, or from supplements, but don't take more than 40 mg per day, as it can interfere with copper absorption and cause nausea or diarrhea. Magnesium. This is another mineral that is important for prostate health, as it can relax the muscles and nerves of the urinary tract, and improve the bladder function and urine flow. Magnesium can also help reduce the stress and anxiety that can worsen the prostate symptoms. You can get magnesium from food, such as spinach, avocado, banana, dark chocolate, and almonds, or from supplements, but don't take more than 350 mg per day, as it can cause diarrhea or cramps. Exercise. This is a lifestyle change that can benefit your prostate health, as it can improve your blood circulation, strengthen your pelvic floor muscles, reduce your weight, and lower your blood pressure and blood sugar, which are all factors that can affect your prostate. Exercise can also boost your mood, energy, and confidence, and enhance your sexual performance and satisfaction. You should aim for at least 30 minutes of moderate exercise, such as walking, jogging, cycling, or swimming, 5 times per week. But avoid activities that put too much pressure on your prostate, such as biking on a hard seat, or lifting heavy weights. Stretching. This is another lifestyle change that can help your prostate health, as it can relieve the tension and pain in your lower pelvic floor, which can be caused by poor posture, sitting for long hours, or injury. Stretching can also improve your flexibility, mobility, and range of motion, and prevent further muscle imbalances or spasms. You should do some lower pelvic floor stretches, such as the frog, the butterfly, the pigeon, or the child's pose, every day, preferably in the morning and before bed. You can find some examples of these stretches online, or you can ask your doctor or physical therapist for guidance. So, these are some of the natural remedies and tips that can help you shrink your prostate and improve your symptoms. By combining vitamin D with these other methods, you can achieve even better results and enjoy a healthier and happier life. I hope you found this video helpful and informative. If you did, please give it a thumbs up and share it with your friends and family who may benefit from it. Also, don't forget to subscribe to my channel and hit the bell icon, so you don't miss any of my future videos. And if you have any questions, comments, or suggestions, please leave them below, and I will try to answer them as soon as possible. Thank you for watching, and I'll see you in the next video. Take care and stay healthy.